Do you need to choose a new health insurance plan? Maybe your employer has multiple plans to offer, or you're separating from your employer and need to choose among COBRA, marketplace plans, or joining your spouse's insurance plan. How do you know which plan is best for you? How do you compare the plans that are offered to you, taking into consideration the premium, deductible, co-pays, and out-of-pocket expenses? What is an HSA? Should you set one up if it's offered? How is it different from an FSA? And what is the difference between a copay, a deductible, and an out-of-pocket maximum? This may not be fun to learn about, but unless you know these things, you will not be able to make an educated decision as to the best health plan for you. Taking a few minutes now to learn this information can save you money and stress down the road when you actually need to use your insurance plan. Stay tuned as I walk you through the basic information you need to know to make the best choice in selecting a health insurance plan. If you then need to go back later to find specifics that apply to your choices, look to the chapter names within this video so that you can jump to aspects of this talk pertaining to specific topics such as deductibles, copays, HMOs, and PPOs. Now get ready for your crash course on selecting a health insurance plan. Hi, for those of you new to my channel, I'm Dr. Lori Creedon-Wright. I'm a board-certified family physician with over 33 years experience in patient care. Now that I've retired, I have the time to create videos that can help people navigate the complexities of the U.S. healthcare system from the standpoint of someone who has not only worked with it as a physician, but also as a patient. I don't sell insurance. I simply want to help others understand their healthcare choices a little better. Any individual question should be addressed with your own healthcare provider or insurance agent. But these videos are meant to provide general information to help increase your knowledge of the ins and outs of healthcare in the United States. Of course, healthcare rules can change, but this information is given to the best of my knowledge at the time this was filmed in 2025. Let's start with the basics. The information that I'm conveying in this video is related to commercial insurance, not Medicare plans. Although some of the information is true for both types of insurance, choosing a Medicare plan has enough differences that it needs to be a topic for a separate video. The first term to understand is premium. Your insurance premium is how much you need to pay each month to participate in that specific insurance plan. If you are insured through your place of employment, your employer may often pay a large part of the total premium. For example, you may pay $100 per month as your insurance premium, but the actual cost of the insurance is $800 per month, and your employer pays $700 of that on your behalf as a benefit of employment. If you separate from your job, you may qualify for COBRA. COBRA is an acronym for Consolidated Omnibus Budget Reconciliation Act, a federal law that allows employees and their dependents to keep their employer's group health insurance after certain qualifying events, such as the loss of their job. However, you don't get to keep that insurance forever, even if you pay the premium. You would need to check with your employer how long you can COBRA your insurance. It is commonly for up to 18 months. However, since your employer would no longer be covering its share of the premium as an employment benefit, you would then be responsible for the full cost of the monthly premium. In our example, that would mean you no longer would pay $100 per month, but instead would need to pay the full $800 per month to continue the health insurance coverage that you currently have. The monthly cost of the premiums for COBRA may be high enough to not make it a viable option for many people as a way to continue their health insurance. A second option may be to be added on to your spouse's insurance. If you have this option, this is typically going to have a much lower premium for you than COBRA of your current plan, because your spouse's employer will again likely be paying a portion of their insurance premium as a benefit of their employment. Even though typically there is only one enrollment period per year, Proof of a qualifying event, such as the loss of a spouse's employment, would allow the employee to change from single coverage to employee plus spouse or family coverage. Of course, the monthly premium would increase as there are more people covered on that plan, but typically it would be far less than paying the full cost of the insurance premium through COBRA. A third option would be to purchase healthcare insurance through the healthcare marketplace. The insurance plans available through the marketplace are accessible at the website www.healthcare.gov for most states. There's a link at that website as well to direct you to the individual states' websites that run their own healthcare marketplaces. The marketplace was set up in 2010 as part of the Affordable Care Act. It is possible that you may find the premiums are similar or even higher than the COBRA premiums for similar coverage. However, many people qualify for tax credits based on income that lower the premiums significantly or can even negate them entirely. So how do you decide which plan is best for you? Plans are often categorized as gold, silver, and bronze, with the plans that offer the best coverage also charging the highest premiums. One important factor is the plan's deductible. The deductible is the amount of money the patient needs to pay out of their own pocket each year before the insurance starts covering the medical expenses. Therefore, plans with a high deductible often have lower premiums than those with a low deductible. Typically, certain preventive or wellness benefits are covered without first needing to meet your deductible. For example, an annual physical exam or wellness visit, annual screening mammograms starting at age 40, a screening colonoscopy every 10 years starting at age 45, and certain screening blood tests. If you are a healthy person who typically only sees a doctor for routine wellness checks, a high deductible plan can make a lot of sense, as long as you would still be able to cover your deductible if an unexpected surgery or other medical condition incurred high medical expenses. Per IRS guidelines in 2025, an HDHP, or high deductible health plan, is a health insurance plan with a deductible of at least $1,650 if you have an individual plan, or a deductible of at least $3,300 if you have a family plan. This means that if your individual deductible is $1,650, once you have paid $1,650 of medical expenses for the year out of your own pocket, your insurance benefits would then kick in. However, if you have your entire family covered on the plan, each individual has to reach $1,650 of medical expenses that they pay for the year before that individual's expenses are covered by the insurance, or the combined family deductible that has been paid is $3,300 for that year. And that doesn't mean that once the deductible is met, that all of your medical expenses are covered in full. It simply means that they are then covered at whatever amount is outlined in your insurance contract. For example, after the deductible is met, some insurances will pay 80-20. This means that they will pay 80% of the remaining expenses and that you are still responsible for 20% of the remaining expenses, even though you have met your deductible. That is where the total out-of-pocket maximum comes in. The out-of-pocket maximum in the insurance contract says, what is the maximum amount of money that you would have to pay in a year before all of your covered healthcare expenses would be paid by the insurance plan? Some insurance plans have fixed charges called copays that are charged when the deductible is reached. For example, there may be a $25 copay to see a primary care provider, a $35 copay to see a specialist, a $45 copay for an urgent care, and $250 for an ER visit, even if the deductible has been met. Only if the annual out-of-pocket maximum has been met would those not be due. Some insurance plans don't have an ER copay if the patient is admitted to the hospital from the ER, but a $250 or more copay if the patient is treated and sent home. Presumably, this was put in place to help prevent frivolous ER visits, but many ER visits are medically necessary, yet not in need of full hospital admission. so the copay would still apply. Therefore, a person who needs frequent doctor's visits or medical tests or has a chronic medical condition that increases their risk of hospitalization would likely be better off selecting an insurance plan with a lower deductible and out-of-pocket expenses, even if their premiums are higher, as they will likely be accruing medical expenses throughout the year. If you have a high deductible plan, you may be given an opportunity to sign up for a health savings account, also known as an HSA. This type of account has tax advantages in that it is funded with pre-tax dollars, and withdrawals may be tax-free if used to pay qualified medical expenses. Some employers also contribute to the HSAs of their employees. This can make it more likely that their employees would pick a high deductible plan with lower premiums for the employer as well as for the employee. There are annual contribution limits to HSAs, and these may vary from year to year, so it is important to check to be aware of these as you set up your contributions to your HSA. But what happens to the money in your HSA if you don't need it that year for medical expenses? Fortunately, the money rolls over from year to year and remains in your HSA. This is different from another type of medical savings account called a flexible savings account, or FSA. So what is an FSA and how is it different from an HSA? An FSA is a tax-advantaged account that may be offered by an employer. A person does not need to be enrolled in a high-deductible plan to contribute to this account, unlike an HSA. The FSA funds may be used to pay for qualified healthcare expenses, but the funds do not roll over from year to year, a situation some people refer to as use it or lose it. Therefore, it's important to be able to make a fairly accurate calculation of your projected healthcare costs for the year in order to know how much money to contribute from each paycheck. As with an HSA, there are annual limits to the contributions, and these may vary from year to year. You may also have heard the terms HMO and PPO. These refer to the type of insurance that you will be selecting. HMO stands for Health Maintenance Organization. It is typically less expensive than PPO insurance because the HMO requires you to stay within their selected HMO network of healthcare providers in order to be covered on that plan. You typically have to select a specific primary care provider, such as a family physician, internist, or pediatrician. That person or their staff may need to enter referrals in order for you to see specialists within the network. Additionally, if the type of care you need is not available within the network, they would need to complete paperwork to explain to the insurance company why the care that you need is not available from a provider in their network. Even if that paperwork is completed, it does not guarantee that an out-of-network referral will be accepted by the insurance plan. A PPO, or Preferred Provider Organization insurance plan, tends to be more costly but gives more freedom of choice to the patient. They typically do not need to select a specific primary care provider and can also typically see specialists without having a referral first. They still typically have a network of providers for which the insurance will cover better than outside of the network, but often they will at least provide some coverage if you go outside the network. If you have a medical condition that requires care from someone outside your local area, it is very important that you check as to how the coverage would be for the out-of-network provider that you have in mind. One more consideration in selecting an insurance plan is their prescription drug coverage. If you are already taking prescription medications, it is worthwhile to check if your meds are on the formulary of the plan you are considering. A formulary, also called a prescription drug list or PDL, is a list of medications covered by that insurance plan. But just because the medication is on the list, it does not necessarily mean that it will be covered for you. Insurances typically categorize their formulary medications into tiers based on the cost, with Tier 1 being the least expensive and easiest to have approved by insurance, and Tiers 2 and 3 progressively more expensive and more restrictive in the criteria that must be met for that prescription to be approved for a patient. Most Tier 1 medications are generic medications that are inexpensive and automatically approved by the insurance plan with a valid, appropriate doctor's prescription. Tiers 2 and 3 tend to contain more expensive generic medications or medications that have no available generic and are only available as name brand. Typically, Tier 2 and 3 medications require a prior authorization, more commonly called a prior auth, in order to be approved by the insurance company. A prior auth is paperwork completed by your doctor or their staff on your behalf, answering questions about why a less expensive alternative isn't being used instead. Typically, the questions ask what other medications in the same category have already been tried, when and for how long, and whether they were ineffective or not well tolerated. And even if a Tier 2 or 3 medication is approved, the associated copay is often much higher than for medications in the lower tiers. When comparing insurance plans, comparing the copays of the medications you are taking can help determine if a plan with a higher premium is worth it to reduce the out-of-pocket monthly copays on your chronic medications. Even with a completed prior authorization, some medications simply are not covered by a particular insurance as they have chosen not to include that medication on their formulary. So that is definitely worth checking if you are already on an expensive medication or expecting to need one in the near future. The ultimate decision as to which health insurance plan is best for you is your decision to make. But I hope this has helped highlight some considerations when making that decision. If possible, refill your chronic medications prior to changing your insurance plan so that you will not have a lapse in taking your prescription medications while prior authorizations are being submitted and reviewed. Just because a medication was approved by one insurance plan does not necessarily mean another one will, as your new insurance may use different criteria than your prior one did in making the determination on whether a prior authorization will be approved. In the meantime, please subscribe to my channel for more tips on navigating the healthcare system, as well as tips on living your best life.